friends. My name is Courtney, and I'm a therapist who helps kids understand their feelings and their thoughts, feel safe in their bodies, and learn tools that make life a little easier. I've spent many years working with children, family, and communities, and one of my favorite things is helping kids feel brave and supported when they're trying something new, like starting therapy. Today, we're going to talk about what therapy is, why it can feel a little scary at first, how you can get ready for your first session when you meet your therapist, what happens in that session, and what to do if you ever feel like you want to stop going to therapy. So let's start by taking a deep breath together in through our noses and blowing it out through our mouths. You're doing great already. Therapy is a place where you get to talk to a grown-up whose job is to help you feel understood, supported, and safe. Some kids go to therapy when they feel worried, sad, confused, angry, or sometimes they just need someone to talk to besides their parents or other trusted adults. And guess what? It's totally normal to feel nervous about it. Trying something new can make your tummy feel wiggly inside. Meeting a new grown-up can feel strange. Talking about feelings can also feel really big. But therapy isn't like a test. You don't have to know what to say. You don't have to tell your therapist everything at once. You just get to be you. Your therapist is there to help you feel comfortable and not to judge you. When you want to get ready for therapy, you don't need to prepare anything fancy. You can bring a favorite toy or a fidget. You can think of one thing that you may want to talk to your therapist about that would help you. You want to wear comfy clothes and bring a grown-up you trust with you to meet the therapist for the first time. You can even say, "I'm nervous," and that's totally okay. Your first therapy session is mostly going to be about getting to know each other. A therapist might ask your name and talk about things that you like. They may show you around their room and explain the rules like what stays private in therapy. They may ask you about how you've been feeling or what you've been doing lately. And they'll also tell you a little bit about how they help kids like you. You can ask questions too, like, what do we do in therapy? Can we take breaks? What if I don't know what to say? There are no wrong questions. Therapists often talk with parents or caregivers too, sometimes with you in the room and sometimes separately. This helps everyone understand how things are going and how to support you. With you there, you might hear your grown-up share things like how school is going or what's been hard lately. You can add your thoughts or just listen. Without you there, your therapist might check in with your grown-up privately to learn more or to make a plan to better support you. You can ask what was talked about if you're curious. You don't have to be a part of every grown-up conversation, but you can always ask what's being shared. Therapists usually keep what you say private. That means they don't tell other people unless it's really important for yours or someone else's safety. Here's what that might look like. Private might be feelings, thoughts, drawings, or stories that you shared. Shared with permission might be things that you say that you want your grown-up to know. Shared for safety are things like if someone is getting hurt or might be in danger. Your therapist will explain these rules in a way that makes sense. You can always ask, will you tell anyone? Or can I keep this just between us? And your therapist will help you understand what needs to be shared and what can stay private. Some kids talk a lot in therapy, some kids talk a little, and other kids don't talk at all. All of these are completely okay. A good therapist understands that talking is only one way to communicate. Therapists often have lots of tools in their office so you can share things in your own way. You may see art and craft materials so you can create something that expresses your mood or your story without using any words at all. They may have lots of books, picture prompts, feeling charts, or cards so you can flip through pages and point to things that feel true to you. Some therapists may even watch videos with you so it helps you feel more comfortable talking or even sharing about things that you feel or think. They may have other play materials in their offices too, like dolls or puppets, stuffed animals, even lots of games that you can show your feelings or stories through pretend play instead of just saying them out loud. Many therapists have fidgets and sensory items like squishy toys or stress balls or putty that help you settle your body so you can think or feel without needing to talk. They'll also do things to help you get up and move, or maybe even have things in their offices like rocking chairs, bean bags, or soft mats so you can move, stretch, or curl up quietly while you get used to the space. A good therapist knows how to stay connected to you even when you're not talking. They sit nearby in a calm, friendly way. They watch for your cues like your body language, your energy, and your comfort level. They follow your lead in play or drawing, and they check in gently, asking questions like, "Is this okay? Do you want to keep going?" They let silence feel safe and not scary, and they help you feel understood even when you're quiet. Not talking doesn't mean that you're doing therapy wrong. It means you're listening to your body and taking your time, which is actually a sign of emotional wisdom. Therapy works best when you feel safe enough to show up exactly as you are. A good therapist will also follow your lead. This means if you feel curious, they'll explore with you. If you feel unsure, they'll slow down. If you feel overwhelmed, they'll help you pause and settle by maybe taking a break or doing one of the other activities we already talked about. You don't have to be ready, you just have to show up. That's brave enough. Now, even with all of these things, sometimes you may still feel very nervous, and again, that is okay. Here are some tools you can use before your session to help you stay calm. You could take slow breaths in through your nose and breathe out through your mouth. You could squeeze a stuffed animal or play with your fidget or some sort of sensory object. Or you can tell yourself, "I can try this." If you start to feel nervous during the session, ask for a break. Again, you can hold a fidget or have a stuffed animal. Tell the therapist if something feels too big to talk about. And after the session, you still want to be able to take care of yourself too. So rest, draw or color, talk to a trusted grown-up. Your feelings are welcome. Sometimes kids want to stop going to therapy suddenly, and this can happen for a lot of reasons. Maybe a hard feeling came up, or they start to feel shy, they don't know what to say, or maybe they're even worried they said something wrong, or they're tired or just feel overwhelmed. But here's the truth. Therapy works best when you keep going, even when it feels a little uncomfortable. If you feel like quitting, you can say, "I don't feel like coming today. Last time was hard." Or you can ask your therapist to go slower. You can ask them to talk about something different. Your therapist's job is to help you feel safe, not to make you push too fast. If you really need a break, you can have a goodbye for now session where you talk about what helped and what you might do next. You don't have to disappear. You deserve support all the way through, and you can come back to therapy at any time. But let's spend some time together to practice some tools about what might help when you feel like you want to quit therapy. And these are called grounding exercises, and your therapist may teach some of these to you. So, the first one, step one, put your hand on your heart and say quietly to yourself, "I'm feeling nervous, and that's okay." Step two, find your feet and wiggle your toes. Feel the floor holding you up. Step 3, take a slow breath in for 4, 3, 4, and blow out through your mouth for 6, 2, 3, 4, 5, 6. Step 4, talk to the nervous part of you. Say, "You're trying to help me. Thank you. We can go slowly." Step 5, look around the room. Name 3 things that you can see. Name 2 things you can touch. Name 1 thing you like about yourself. And remember, you are safe, you are strong, you can do hard things with support. Therapy is a brave step. It's a place where you get to learn about your feelings, your thoughts, your strengths, and your story. If you're starting therapy soon, I hope this helps you feel a little more ready and a lot more supported. You are not alone. You are growing, and you are doing an amazing job.